And the fact that you're thinking about it tells me you're going to be okay. It's the students who don't put any thought into it and they're like, oh, I just want to be a doctor. Let me go apply for medical school. Those are the ones who struggle. Ask Dr. Gray Premed Q&A brought to you by Blueprint MCAT. How you doing today?
I'm good. How are you?
I am wonderful. What can I help you with?
So, I'm currently looking into transitioning into the medical field, but I'm still trying to assess whether it's something that I do want to do.
Okay.
So one of the steps that I have taken is enroll in a scribing position. I'm currently working through, I just completed my online training. The only thing that I have left is the in-person training. And so that would be a huge determining factor in obviously if I would enjoy the role as a doctor, but if this is something that I want to pursue, I want to make sure that I pursue it in the most appropriate way possible. Making sure that I know that you mentioned that you shouldn't be checking off check boxes, right? But I do want to make sure that I have a very solid application. And from what you've said, that it's getting even harder and harder to apply to a lot of these schools. So, yeah. So I just want to make sure that I look like a good candidate. So. Yeah.
Awesome. So, first things first, get a scribe position, right? Obviously, putting yourself in and around the doctor world is a great thing to do. The one downfall that scribing has, scribing is a great clinical experience. The one downfall that it has is that it limits your ability to interact with patients. And so if you can find maybe a volunteer hospice position or something else where you can actually be with patients and not just in the room and listening to doctors and typing all of the notes and doing all of that stuff, and you can actually just be with patients, I would highly recommend that as well. Because at its core, that's what medicine is. It's being with patients. So if you enjoy that aspect, then that's a good thing, right? Just being with patients. Obviously, yes, you have to love what the doctor does and love that interaction and love that environment and all of that fun stuff as well. So it's great job listening, heeding my advice, and actually going and getting some clinical experiences to help you with that exploration.
Yeah. And the one thing that I do want to know is I come from an engineering background, and my grades in school were never 4.0s. I made decent grades. I think in undergrad I had a 3.49, and I recently got my master's, and I had a 3.5 master's. So there's not much marginal improvement, which I know what they look for typically whenever they're looking at your undergrad versus your graduate degree. And so if I were to enroll in medical school, I know that I don't necessarily need to go back to and get another degree, but I do need the prereqs taken at a accredited college. And from what I understand, it's better to take them at a 4-year university than it is a 2-year university. And so that's I'm looking into taking those classes and then making sure that I make A's from here on out, and then also making sure that I at least score decently on the MCAT. But the dream school that I've looked into, their GPA requirements are 3. I think they're median.
So stop. Yeah. So you caught yourself, right?
Yes. There's no requirement.
There's no requirements. Good job catching yourself. Okay.
So their median GPA is around 3.8.
Yep.
And their average MCAT score is around 517. And this is coming from, I guess, their website. I'll go ahead and talk about the university. It's UT Southwestern.
Okay.
And so and so those are the two requirements that I think I can possibly, with a lot of studying, obviously get into the MCAT, but there's no mathematical way that I can reach that.
Well, there is in about 15 years of classes.
Yeah, if I were to go back and retake absolutely everything, but is that something that would be worth it? Because when I started, I think I made a C in Chem 1. Obviously, if I retake it now, I don't think it would be very difficult to make an A in Chem 1. Yeah. But is that something that I should look into doing, and then retaking, I guess, science classes that I didn't score well in, and then just continuing on with the required classes for the MCAT?
Yeah,
or
so
for the school.
for the school, definitely. So
Mhm.
I love how you're catching all of your
Mistakes.
slip ups here with your language, because it's important. And I
Mhm.
very much am like, no, like people say, oh, the average MCAT. No, the median that the MSAR shows. Average
Mhm.
and median are very different, or can be
Different.
very different. The average may
Mhm.
be exactly the same. We don't know that. But anyway, so in terms of classes, when we look at a C from Chem 1, right, that from
Mhm.
however many years ago, there's no like hard requirement that you have to take that again, right?
Mhm.
C minus is typically the cutoff. Of if you got a C minus, that typically is not passing for medical schools.
Mhm.
So anything where you got a C minus in a prereq, yes, retake it. Outside of that, the question always is, what is your foundational knowledge to be able to take that next class in the sequence? So
Mhm.
Gen Chem 1 would be Gen Chem 2. If you
Right.
think you're okay for Gen Chem 2 and you can get an A in it, then great. Why repeat Gen Chem 1?
Mhm.
With the one exception of this silly test called the MCAT that is still out there. And will it be of benefit for you to just kind of start fresh and go,
Mhm.
okay, I'm basically a career-changing non-trad, and I'm
Yeah.
going to take all of my sequence over again, all of my prereqs. So starting at
Mhm.
Gen Chem 1, Bio 1, and just
Mhm.
go through that. Build the foundation, get the science credits trend up, and
Mhm.
build the foundation for the MCAT.
Okay. So that's where you would start. And I know that you can label some classes, like on your application, you can label some classes towards your science classes. And typically with my engineering classes, I got a degree in biomedical engineering. I
Mhm.
don't know if that helps anyone, but I from what I understand, it doesn't matter what degree you have. It's about the classes that you take within
It's
that
the
degree.
individual classes, and so I highly
Mhm.
recommend just Googling AMCAS course classification guide, a COMIS course classification guide, TMDSAS course classification guide, and see specifically where your classes may wind up. And I
Mhm.
stress may, because at the end of the day, you can label something as a science credit class,
Mhm.
even if AMCAS is like, yeah, no, like those classes aren't science classes. And you can label it science, and you can have the AAMC go check into it. And they'll go and they'll look at the syllabus. They'll talk to the school and figure out what's being taught in that class. And they'll go, oh, yeah, that's a science class. We agree.
Okay.
So it really just matters what's the class, what's in the syllabus, what was taught. Because you
Mhm.
can't just look at bio classified courses, because
Mhm.
there may be a writing for biologists class, which is an English
Mhm.
class, right? It's a writing
Mhm.
class, but it's listed as a bio 1, 2, 3.
Mhm.
So you actually, like, for everyone, not you, just you specifically, you have
Mhm.
to use your noggin and think critically and go, well, what was this class? I know that in general, and kinesiology is always the biggest one for me that pisses me off, that AMCAS labels kinesiology as not science.
Interesting.
And I'm like, but like
Everything that you're,
it's
yeah.
physiology, it's exercise physiology. What are you talking about? It's not science. And so that's the one where I really stress to students. You can't look at that classification of, oh, kinesiology isn't science. You have to go course by course by course by course and go, this is physiology of muscle fibers. Of course that's a science class. Right?
Mhm.
So just, yeah, takes
So
some
it's a
research.
matter of how it relates to medicine as opposed to
Yeah,
whether
and
it's
not even
something.
medicine, right? Because math is
Oh, okay.
considered science. So
Okay,
it's
fair enough.
literally like, is it a chemistry type class? Is it a biology type class? Is it a
So
math
if I
type
took
class?
so if I took a class that say interfaced with like high level math, like so for instance like differential equations, and then I was
Correct.
solving differential equations and I was applying them to like specific real world concepts. Essentially, it's you have these problems listed in front of you. Like for instance, patient is receiving this much. This much medicine per hour. What's the concentration of that medicine in their blood? That would, that involves lots of, lots of, I guess, not startup. What's the word I'm looking for? there's a lot of initial variables that that you need to know about the patient, about the drug, and then there's a lot of math that's also involved with determining that concentration, because it varies with time, and it varies with the position it is in the body. So so that would be something that would you would think might be labeled as a science course, right?
Yeah, potentially.
Okay, fair enough. Awesome. And then I guess the next thing that I would need to know is this upward trend from leaving engineering, working in the real world, because I've had about two years experience. Is this upward trend alongside with me working two positions, working as an engineer full time, working as a scribe part time, going to these classes and studying for NCAT? Is that something that they consider in the applications, or is that something that I would have to spell out? Because it is a lot of work. And
consider in what way? What do you mean by that?
Considered as in, like, the student is able to handle all of these individual things. I might not have a lot of extracurricular activities because I physically do not have enough time for that. Between juggling multiple jobs and juggling studying in classes.
Yep.
So is that something that they would consider?
Yep.
Okay. Fair enough. Yeah, because that's I do see that there's a lot of people that have tons and tons of clinical hours, and I can
the amount of clinical hours isn't important. The fact that you get them, and you're consistent with them, and you've reflected on them enough so that you can write about why they're important to you. There are plenty of students out there with like 4,000 hours of clinical experience who just do it because they show up and they get the hours in and they think that's the important part of it, and they don't think about it. They don't care about it. Like, those students aren't going to do well when it comes to writing about it, talking about it, etc. So it's not about total hours. It's about have you been doing it consistently, currently? I got an application in the other day just from I get lots of applications. Students are like, "Hey, Dr. Gray, look at my application." And don't send me any more unless I specifically ask you. Don't send them. And the ones that I can look at and actually provide any sort of information on, this one that came in the other day, I was talking to the student. She's like, "Well, I'm concerned about my essays." So I'm like, "Well, let me see your application." This is her second application cycle. She's only gotten 2 interviews at the same school, both application cycles. Hasn't gotten in. She thinks it's her essays that's holding her back. And so I got her application, and the first thing that I go to, outside of, like, are your stats horrendous? And hers weren't, and she's in SMP and crushing it now. The next thing that I go to is, let me see your clinical experience. And her clinical experience, her most recent clinical experience, as we're recording this in March of 2022, was 2019.
Oh, wow.
And I don't care if you have 5,000 hours of clinical experience. If you stopped in 2019, that tells me that you don't like it enough to continue being around patients and doctors and all of that stuff.
So that alone can be a huge determining factor. The fact that you stopped it, regardless of what the reason is. Wow. Okay.
Yeah.
So then I guess from there, is there something that I'm missing out of this equation? What's the best thing that I can do as a person who's transitioning from engineering to medicine, if this is indeed something that I want to pursue? Like, that's the best thing that I can do.
So can I tell you that your line of questioning is just like super, like, oh, you're definitely an engineer. Like, let me line it up exactly how I need. No, you're thinking about it all, right? You're getting the experiences. You're thinking about the classes. Obviously, the MCAT's out there. You're thinking about all of the right stuff. And the fact that you're thinking about it tells me you're going to be okay. It's the students who don't put any thought into it, and they're like, "Oh, I just want to be a doctor. Let me go apply for medical school." Those are the ones who struggle. So you're doing it all.
Okay, fair enough. So I guess to go over this, applying for the application, I guess, for medical school, at what point should I look to at what point should I look to, because if I need to study for the MCAT, I will need some time. So I probably would have to quit my full-time job, and based off the information that you gave me, definitely not quit the part-time job of being a scribe, and maybe even pushing that towards like the full-time mark. But the thing that I would need to do, right, would be at least in regards to the application, would be making sure that I have that consistent clinical experience, make sure that I continue with an upward trend on my grades, and then finally, should I add any like shadowing hours or
shadowing to me is just as important as clinical.
Okay.
And when I say that, for non-trads, so for non-trads, especially if you're in this career changer kind of world, in general, clinical experience is more important than shadowing, but shadowing is very important, and you should have it, and it should be consistent, and all of that fun stuff. So, big picture, like more clinical experience, and then if you can shadow once a month or so, then do that.
Yeah, it's just the fact that you're shadowing consistently. Like if I shadowed for, let's say 8 hours a month, I'm still doing that every single month. So in terms of how long I've done it over a period of time, I've done it. I haven't done that many hours, but in terms of the consistency, it's been very consistent every single month.
Correct.
Okay. So is there? Am I already standing out because I'm a non-trad, is that a bad thing? Do people look at non-trads in a negative light?
There may be some people, right? Humans are humans, and we all have our biases and judgments and all of that fun stuff. So there may be someone who looks at your application going like, "What are you doing here? Like, just go keep doing what you're doing. We don't want to train you. You're old, and you're not going to have enough time to actually work long enough in the field, whatever." Right? There are people out there who think that about non-traditional students, especially older non-traditional students, like 50s. The far majority, most likely, in my opinion, are going to go, "Oh, this is interesting." You come with lots of other experiences. You'll be a great fit for our class, and you'll bring lots of kind of real world knowledge and thoughts and experiences and explorations into our community, filled with mostly traditional students who are just coming out of college or maybe a year or two out and not out working in the real world, but just strengthening the application and other stuff because they've always known they wanted to go to med school.
Fair enough. And then as far as age goes, I know that at some point they do look at the older people, I would like to say, and they say they might say that you may not be a good fit because of your age. Is that true? And if so, at what point do they consider that you're too old?
Yeah. So I would hope that it's not true, because there's this little thing called the law that says age discrimination is illegal. So but again, humans are humans, and we have our biases and whatever else. So there's nothing you can do.
Okay.
Right? What is that question? What is the answer going to solve for you? If I told you, "Oh yeah, like there's lots of age discrimination," are you going to go, "Okay, never mind. I'll give up on my dream"? No, you'd be like, "Screw you.
Yeah.
I'll prove them all wrong.
I'll do it anyways."
Exactly. Yeah. So that question to me is just like, understand that the world is not fair, that there is bias out there, and that most likely you'll be fine.
Well, that helped me out a lot. I was definitely thinking the other way. I've had some friends of mine who have had other friends who've went at later stages of their life, and they've succeeded in their careers, and they've done well. But they have told me about sometimes you do get, I guess, maybe in a classroom setting, but you do get looked at differently.
Yeah.
But yeah, so I really appreciate that input.
Yeah.
I guess trying to think of a final question here. As far as I guess I'd be asking you about your personal experience, if that's okay.
Sure.
So personally, what have you found in the medical field that you've enjoyed? And likewise, on the exact opposite end, what have you disliked? Because I know that from what I've researched, majority of people dislike the bureaucratic tasks that they have to perform during during their practice.
Yeah.
And so I was wondering if that's in line with what you dislike, and honestly, I wanted to hear what you liked.
Yeah, so my experience is different because I served in the military as a military physician, and so I didn't have to deal with a lot of the bureaucracy, a lot of the insurance issue nightmares. There's some of it. Obviously, charting. You're charting everywhere you go, no matter what. And I think the far majority of physicians will talk about charting as kind of the bane of their existence. Charting was not invented to make doctors' lives easier. Charting was invented to increase billing for hospitals and clinics, so that we're checking off all of the boxes that Medicare and all of the other private insurance companies say we have to do to get our $5 for a patient visit, whatever it is.
So you think it detracts from the patient's overall, I guess, care, right? Because if they're taking this time to chart as opposed to thinking about the patient?
Well, it depends, right? A lot of physicians chart at home at night on their own time.
Fair enough.
Because they have to take care of the patient when the patient's in front of them. So it really just depends. There are some doctors that will sit behind the computer screen and the patient's on the other side and don't make eye contact and are just asking questions and typing. And it's a horrible experience for the patient. So charting is the bane of everyone's existence. So as an engineer, go create the next great EMR or the next great artificial intelligence and speech recognition software. My big dream, and I know there are companies out there working on it, to where there are microphones in the room and speech recognition software is running, just listening to what the doctor and patient are saying, and it's like an auto scribe. To where it's just all being input into the computer, and the doctor just triggers off some keywords when doing a physical exam to capture that, because a lot of physical exam is just visual, right? So just triggering some keywords to capture physical exam.
Musculoskeletal.
Exactly, like left knee range of motion 300, whatever. It's a random number that's definitely not 300.
300.
their knee just goes in a circle. Yeah. Anyway, so charting definitely. The best thing about medicine, and the thing that I always go to when people complain about medicine. And obviously, I'm not practicing anymore. My wife practices, so I still see it through her lens. The best thing about medicine is just being with a patient behind closed doors, not in the moment worrying about who's paying for what and if the insurance company is going to deny or approve a test or what have you. It's just being there for another human being. And that feeling, that interaction is irreplaceable.
Absolutely. Yeah. I haven't been able to experience that, but being with people and being able to sit down and have genuine conversations with people, even if it's outside the scope of work, it's always something that I've enjoyed. And that's why I'm really looking forward to this scribing position, so that I can genuinely tell myself if this is something that I would like or something that I would dislike, and then based off that decision, there's 100 more things that need to happen. Yeah. It's but yeah. All right. Thank you so much for answering that question. I honestly didn't know if you were or you weren't, but I really appreciate it.
Yeah, no problem.
All right. Thank you so much, Dr. Gray. Sorry to soak up so much of your time.
No worries.
I really appreciate it.
Yeah. Good luck.
All right. Thank you. I'll keep you updated.